Hello, Mama B. How are you? Hope you are keeping safe.
Hello, Dr. B. How are you? I'm fine, Lord. Thank you very much. Yes, I'm keeping safe. Thank you. I don't go out though. I don't go out. Even if I go out there, I always wear a mask. And I try to sanitize my hands every 2 minutes.
That's good though. That's good. May God keep us in this COVID era.
I even wanted to come and see you, but because of this social distancing, that's why I've not been able to come. But thank you for calling me. Yes, I have one bad news. So, my close friend's brother has cancer, liver cancer. They've admitted him for 42-year-old man, a young man. They said they discovered a hepatitis virus infection.
That's very serious. Yes, hepatitis B is another killer virus.
Now wow for all these evil viruses, terrible ones that they don't have cure. HIV, hepatitis, COVID-19, that's what they call it. Now wow, what will save us?
Mama B, calm down,
Please, Dr. Faye, tell me about it. I want to know more about this. What can cause it? Does it have cure? What can cause it? Tell me.
Hepatitis is inflammation or infection of the liver. It can be caused by quite a few things: too much alcohol, too much fat, but the most common cause of hepatitis is viruses, viral infection. That's what we call viral hepatitis. There are 5 main types of hepatitis viruses: hepatitis A, B, C, D, and E. But the 2 most notorious ones are hepatitis B and C. They are responsible for over 1 million deaths every year due to hepatitis.
Oh wow.
Hepatitis B attacks the liver and can cause short and long-term disease. It can be passed from mother to child while pregnant or during delivery, and can also be passed from one child to another, usually in the first 5 years of life. It can also be contacted through body fluids and blood. Sharp infected objects that are contaminated with blood that has the virus. This can happen through tattooing, piercing, or using unsterilized medical equipment. It can also be transmitted through sexual activity.
Now what?
Hepatitis B is a highly infectious virus.
This hepatitis, does it have any symptoms? How will people know that they have it?
But most people do not experience any symptoms at the initial stage. But sometimes people can develop an acute illness, a fever-like illness, with yellowness of the eyes, abdominal pain, nausea, vomiting, extreme tiredness. And then a few people can develop very severe disease that can result in death.
It's a killer disease.
Then for hepatitis B and C, some people will develop chronic disease, which if not properly treated and monitored, can result in liver damage, which we call cirrhosis and liver cancer.
Doctor, that's the one that affects my friend's brother. Oh God.
Thankfully, hepatitis B has a vaccine that can prevent it. If people take this vaccine, they will not be able to develop hepatitis B infection. The vaccine is now given to all children. However, it was just instituted as part of the immunization schedule about 25 years ago. So people who are older than the age of 25 may not have received it at birth. And that is why everyone needs to go for testing to know their hepatitis status, both hepatitis B and C. If they are negative, then they should proceed for immunization if they have no record of immunization. But if they are positive, they should see a doctor, preferably a specialist in hepatitis, for further treatment and monitoring.
What do you say? That you can treat it?
Yes, there's treatment. The chronic types of hepatitis B can be treated and suppressed with medications. And hepatitis C has medications that can even cure the virus from the body.
That's good news.
But if a person who has hepatitis B doesn't take any treatment, they are at risk of developing severe liver complications and death.
Doctor, this one you have told me, tomorrow morning, all my family, all of us, myself, my husband, my children, my driver, my household, everybody waiting for my environment, we will go hospital, we will go for hepatitis screening. Yes, and immunization if we test negative.
Mama B, is very important. Remember that when taking the vaccine, they have to take 3 doses. They take the first one, then the second dose 1 month after the first, and the third dose 6 months after the first. Please spread the word about hepatitis prevention and immunization and treatment to your family, your friends, your co-workers, to everyone around you.
Yes, so everybody around, nobody will be left behind. But
if everyone takes this immunization and those who are positive go for treatment, we have a chance of having a hepatitis-free future.
I will spread the word about hepatitis, about the prevention, how people can get treatment, so that we can have a world that is hepatitis-free and COVID-free too. Thank you for touching me. Evil viruses, back to sender, to Fiafwa.
Mama B, amen, oh, amen, back to sender. Take care of yourself, man, stay safe.
Thank you for what you have told me. Thank you.